afternoon. I'm Julie Gibbs, the Director of the Riley County Health Department and also the local health officer for Riley County. This is your daily update in regards to COVID-19. As of today, we have had 126 positive cases in Kansas. This is up by 28 cases, which is one of the biggest increases we've seen. 22 counties have been affected. There are now 3 deaths in the Kansas City area. Of those 126 positives, 72 are male and 54 are female. There have been a total of 2,360 negatives statewide. Here in Riley County, we have tested about 40 so far, all being negative, with the 1 positive in Pottawatomie County. We currently have 8 pending tests. In coordination with Konza Prairie Health Center, we did initiate a drive-through swabbing station this week. This is taking place at the Family and Child Resource Center, directly across from the Riley County Health Department. This is only for individuals who have symptoms and have been evaluated by their provider. We cannot allow for individuals to drive through without those measures in place. The first step is to call the screening call center. If you have symptoms such as fever, cough, shortness of breath, please call this line. It is 785-323-6400. This is managed by healthcare professionals and will be available every day from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. This is only if you're experiencing symptoms such as fever, cough, shortness of breath. From there, depending on your condition, you may be directed to call your primary care provider for further evaluation. At that point, they may direct you to the swabbing station. Again, please call the screening center first at 785-323-6400. The current order that has been put in place is there to protect you, and the overall message is to stay at home. By doing this, we can flatten the curve and prevent the healthcare system from being overwhelmed. If you have questions specific to the current order in place, we have set up a Q&A hotline. This will be answered by qualified staff Monday through Friday, 8 to 5. This is an attempt to clarify the order and what businesses are exempt and what guidelines they should follow. That number is 785-587-4526. Please be patient as call volumes may be high. Again, that number is 785-587-4526. We are encouraged to see that people are practicing social distancing and that businesses are going out of their way to help to reduce risk. Thank you for this. I am now turning this over to Officer Muldrop, the Assistant Director for the Riley County Police Department.
We're going to pause just a moment. Would you check your mic real quick? Would you talk into the mic here?
Hello, this is Assistant Director Muldrop.
We've got signal from both. Thank you. Pardon the interruption.
As she said, Assistant Director Muldrop here. What I want to address first today is rumor control. I've been told that out on social media there's talk about potential requirement for travel papers. I want to make sure it's clear that we at the EOC are planning for every contingency, but this is a topic that hasn't even come up. It's not even been addressed. I do not anticipate that we would have a need for travel papers, so I want to put that to rest. The next thing would be grocery stores and pharmacies. It's important for you to know that they were open 6 weeks ago, that they are open today, and that they will remain open in the future. It's important for you to remember that. If we put out any additions to the orders or any surrounding counties make changes to orders, please don't panic buy. Don't go out to the stores and start hoarding and buying everything up. You don't need to do that. The stores will remain open. Please stop buying toilet paper. We need it too. Thank you. The next thing I'd like to say is we have officers that are going out and trying to be proactive with the businesses. We're providing them packets, best practice packets. This is to help them understand from businesses that have been doing this and doing a very good job of it. We've put together this packet to help businesses to know how to implement the social distancing and keep the public being able to continue to use the businesses. So we're trying to be proactive in helping businesses stay open. So we want to continue to encourage the public to maintain the social distancing, but also don't get involved in social disengagement. Stay in contact with one another. It's important during this time that we continue to do that. We have time for additional questions if people have any.
Okay. Julie, I've got one for you. Do you have any information about the ages of people in Kansas who've tested positive or those 3 fatalities?
The median age is 52, and I don't have much more information on the fatalities other than they are in the Kansas City area.
Great, thank you very much. We can continue to take questions. Are we going to get, let's see, people are asking about the PPE, the personal protective equipment in town, if one of you would address that.
Right, so we are looking at, the question was about personal protective equipment, PPE. As part of our EOC, or Emergency Operation Center, we are talking about that on a daily basis, making sure that we know what others have in the area, including our healthcare providers. So we have a needs assessment. We now know what everyone has and what is needed, and making sure that we're on top of that and monitoring that.
Excellent. Let's see. Can you talk a little bit more about what officers are seeing out in the field today while they're on patrol?
Yes, I'm being told that as officers the question is about what officers are seeing while they're out on patrol out in the field. What I'm getting reports of and what I've observed myself is, as I said yesterday, a decrease in the amount of people out and about moving. We do see a lot of people out and about moving, but I think they're maintaining the social distancing. As we see people in the parks walking, groups of people standing together talking, they're doing it in groups less than 10 and maintaining the social distance. So I do think that we're continuing to try and find that balance of staying at home, having these restrictions, but also still being an engaged community. So I think we're seeing a positive result of this.
And part of that, it is okay to go outside for exercise and walks.
That's good, and I know it seems like a confusing thing to say. Stay at home, and then we're talking about being outside. The idea is to be out as little as possible, but you need to be out and exercise, enjoy the beautiful weather, yard work, etc., but maintain that social distancing, or areas where you congregate in groups more than 10, or in confined areas where the chance for you to breathe on each other increases, because that's how this virus is being transmitted the most.
Can you address a little bit, we've got some questions about the potential for a stay-at-home order. Can you talk about what might be a trigger for that?
So the question is, what could be a trigger for stay-at-home orders? Right now, we continue to discuss this, but at this point, it's going to be evidence of community spread. And the fact that we don't have a positive in Riley County is very encouraging. So that's going to be one of the things we'll look at is, even if we were to get a positive, it wouldn't necessarily mean that we'd go to a stay-at-home order. What we're trying to do in the EOC is base it on the evidence that we see occurring in Riley County, not just those around us, but what's occurring here, and then make the decisions that seem to fit best for the activity that we're seeing here in Riley County.
This question is for Julie. So the students who were in quarantine from Italy, do you have an update about their condition?
So the question is, the students that were in quarantine from Italy, is there an update? And yes, there is. They are finished with their quarantine. They have finished those 14 days.
Did any of them have symptoms?
None have symptoms. No.
Okay. People are asking a little bit about donations. Do you have any advice for that? At this time, we are not taking donations, correct?
Yes, the question is, are you taking donations? And we are not at this time. We are in communication with Greater Manhattan Community Foundation to see if there might be a good location for donations. But stay tuned. We'll put that on social media when we have a location.
Okay. Let's see. Do you have any information about how many local people are under quarantine advice, or can you talk about contact tracing?
Sure. So the question was contact tracing locally, or those individuals who are quarantined locally. We have, I think, in between about 20 and 30 that have been under quarantine, and that is without the students that came back from Italy. We monitor those individuals daily. We do have contact with them daily through our health department, and so we want to monitor for symptoms, and of course if they do develop any symptoms, we want them to call their healthcare provider immediately.
Okay, last time, this will be our last question. You mentioned 8 pending tests. Is there a timeline for result tests?
Yes, the timeline has been anywhere from 3 to 4 days at this time. Oh, sorry, the timeline for test results is 3 to 4 days.
Okay, thank you so much.